Hello everyone, my name is Moiz Saeed. I'm one of the internal medicine residents at Michigan State University in Sparrow Hospital, East Lansing, Michigan. I'm going to present a rare case of a left ventricular Masson tumor. Not every heart tumor is a myxoma. A Masson tumor is a rare but benign vascular lesion that is described as an intravascular papillary endothelial hyperplasia of the endothelial cells. It is most commonly located in the veins and arteries of skin or subcutaneous tissue in the head, neck, and upper extremities. However, many unusual locations have been described in the literature. Here we are presenting a rare case of a patient who was admitted to the hospital for palpitations and was later diagnosed with a left ventricular Masson tumor. Let's move on to the case description. So our patient was a 24-year-old female with a past medical history of GERD and migraine headaches. She presented initially to her primary care provider complaining of palpitations for around 1 month. These episodes occurred unexpectedly with no identifiable trigger, and she described associated lightheadedness. She denied any other symptoms like chest pain or syncope. Initially, an EKG was done, which was unremarkable. She also had an echocardiogram which showed a mobile echo density in the left ventricle, which raised concern for a myxoma. She was admitted to the hospital for further workup and evaluation. A thrombophilia workup was sent, which came back negative, and she also had a coronary CTA done, which demonstrated normal coronaries and a left ventricular mass that enhanced slightly with contrast, suggestive of vascularity. This, as you can see, is the CTA, and this is the mass that we were talking about. She also had a cardiac MRI done, which showed a spherical 8 by 10 by 10 millimeter mass located in the mid-apical inferior portion of the left ventricle, and it projected around 13 millimeters into the body of the left ventricle. The mass had a thin stalk attached to the inferior wall. Cardiothoracic surgery performed open heart surgery, and the mass was excised with no post-op complications. A sample was sent to pathology, and the report showed an organized thrombus with papillary endothelial hyperplasia or a Masson tumor with no signs of malignancy. The patient was discharged on aspirin, metoprolol, and colchicine, and she has had no recurrence of symptoms on her follow-up appointments. Masson tumor is a rare vascular tumor that typically presents in the vessels of the head, neck, and upper extremities. It should always be included in the differential diagnosis of a small, well-defined vascular hypoechoic soft tissue mass. For curative treatment, complete resection should be performed, as residual tumor can aggressively recur. To our knowledge and from our literature research, Masson tumors located in the left ventricle have not been reported yet. There is a previous case report stating a location in the left atrial appendage, which is also an uncommon site for this tumor. Risk factors for this tumor are not known, and it is hard to determine a potential cause in our patient, who was young and had no evident predisposing factors. This patient was diagnosed with a left ventricular Masson tumor. Because similar tumors are typically reported in soft tissue and mucosa, this case is unique. Although definitive diagnosis can only be made through histology, it is important to perform a complete lab workup, ruling out conditions that can predispose patients to thrombi formation. Multimodality imaging can help characterize the heart mass and determine structural complications that may affect cardiovascular function. Patients need a close follow-up after surgery to evaluate for recurrence, since tumor formation can recur in various locations, which can potentially increase morbidity and mortality in these patients. Thank you so much for your time.